Alright, this is my audience. Alright, Joey is a 5-year-old who constantly needs to crawl on the ground in circles and look at any item from every angle. When Joey is hungry, wet, or tired, he begins to repetitively hit himself on the head with his hand. He has limited verbal skills and communicates by using short verbalizations from his parents and his therapist. Joey has been diagnosed as autistic. Autism is defined as a developmental disorder that appears by the age of 3 and is a variable in expression, but is recognized and diagnosed by social impairment, the ability to form normal social relationships, by impairment of the ability to communicate with others, and by stereotype behavior patterns, especially as exhibited by the preoccupation with repetitive activities of restricted focus rather than flexible and imaginative ones. People with autism tend to have difficulties in the following areas of motor coordination, attention, and physical health issues, such as sleep and gastrointestinal disturbances. Although they have a lot of difficulties, they also can excel in many areas, which include math, art, and visual skills. Up until this year, autism was divided into distinct subtypes, which included autistic disorder, childhood dysregulative disorder, pervasive developmental disorder, and Asperger's syndrome. Up until 2000 of May, the DSM-5 diagnostic manual released that all autism disorders will be merged into one disorder known as the Autism Spectrum Disorder, or ASD. The U.S. Centers for Disease Control identified that 1 in 88 American children are on the autism spectrum, and that boys are 4 to 5 times more likely to have autism than girls. 1 out of 54 boys have autism, and 1 in 252 girls have autism. I currently work with children with autism as a therapist for about 2 years now, and work with children like Joey, and met children on all levels of the spectrum. So what causes autism? What symptoms are shown? And what are treatment options available? Some of the causes include environmental factors and genetics that can influence early brain development. Scientists have discovered multiple gene mutations associated with autism, and some which are even enough to cause autism by itself. An environmental factor would be a stir which often occurs during birth or before the child is born. Some factors can include parental age, maternal illness, and difficulties while in birth if oxygen deprivation occurs to the brain. One new research study suggests that parents should take prenatal vitamins such that contain folic acid, or eating foods rich in folic acid can reduce your risk of getting autism. And it's always easy to identify someone with ASD by casual observation, but symptoms vary greatly among individuals. Some symptoms might include social and communication to repetitive behaviors. According to Autism Speaks, about 25% of all children with autism are nonverbal and need to find other means of communication. The National Autism Association recognized early identification symptoms that include the child does not make eye contact, does not respond to their name, follow objects or gestures, or make requests. Another symptom could be that they have repetitive motions and talk, and will constantly repeat what other people are saying. Some of these other behaviors can also include hand clapping, rocking, jumping and twirling, arranging and rearranging objects, and repeating sounds, words, or phrases as stated by Autism Speaks. While someone cannot cure ASD, there are different types of intervention and treatment available. Most commonly, people attend intervention therapy or have medications depending on the individual. The treatment is early intervention treatment, which consists of therapists coming to homes like myself, of the clients, and working with the children. So medication is also an option for treatment, and they often use medication for other common conditions that are associated with ASD, which can include sleep disturbance, seizures, and gastrointestinal distress. By treating these conditions, it can help improve behaviors as well as attention and learning behaviors. In conclusion, ASD is still a highly researched topic and has made significant gains in the past 5 years. It is a developmental disorder that affects the brain chemistry, causes difficulties in social, communicative, and other behaviors. ASD is a unique disorder that can affect anybody. It is important to stay educated on how to improve the lives of people on the spectrum. All right, this is my audience.